success in any service industry. And that's availability, affability, and ability. And in that order. Availability. Let's just take 3 examples. You're new in the hospital. You're going around the hospital, kind of introducing yourselves, and there's a couple of nursing stations, you're seeing some doctor, and a guy comes up and you say, "Oh, are you that new surgeon?" "Yeah, I'm Bilderbeck. Yeah, well, I admitted a patient last night up on the 8th floor, and I may have small bowel obstruction." Okay, here's what you don't do. Why don't you call my office and tell my office the patient's name and, give them the room number, and I'll see him later this afternoon. And you don't have anything to do. You're making round. Go right. No, what you say is, absolutely. I've had a lot of experience with small bowel obstruction. Where is that patient? What floor are they on? Do you know if they've had any previous operations? And like I'll say, gosh, is that important? You don't criticize. You don't say. You just say, "I'm going to go up there right now. Do you know if they've had any images? Do you think we should order a CAT scan or something?" Anyway, so just say, "Here's my name. I'll call you later today. How's the best way to get in touch with us? What our plans to do?" Or you go down to doctor's dining room. You're sitting down there. Guys stepped up. You're real friendly. You're talking, tell him that you're new in the hospital. He says, "Oh, well, my older brother, he's 70 years old. He has 2 hernias apparently at the same time. He's had them for a long time, but he didn't just want to get them fixed. But now they're starting to ache a little bit. And he went to a doctor, and they said they're going to do 1 hernia, and then they're going to wait a month and do the other hernia." No, I'd be happy to see that. What's his name and number? I'll call him right now. I'm going to give him a call, and we'll arrange for him to come over. He's about 30 miles away. Well, we'll arrange for him to come, and we'll talk it over on the phone, and when he gets here, we'll operate on the next day or later that afternoon. We'll just take care of it. Or you're on call for the first weekend in the new hospital. Guy calls you up, and you get on the phone, he says, "I am physically and mentally exhausted. I've been up for the last 3 nights with a patient I operated on, 7 days or 10 days ago, and oh my God, there's pus coming out one drain, and there's blood coming out the other drain, and here's what you say: I'm going to take care of that patient. You put him in an ambulance right now and send him to the hospital. I'll be there. What's his name? I'm going to notify them. What operation did you do? Oh God, it was 10 days ago. Let's see. Well, here, I'll give you my email or something. Give me the information, or just pin the operative note on the patient's dead sheet. I didn't get around to dictate that operative note. Let's not question anymore. Just get them in the ambulance. If you can, write the name of the operation you did, maybe what the diagnosis was. You want to say yes. Earlier today, Dr. McIntyre, trying to get promoted, she said yes to a lot of things. Well, if you want to get a patient, you don't say no. You're going to say yes. Because you have the ability. You come to Virginia Mason, you have the ability. You may be nervous about a case or two, and you may want to have a senior partner help you, but, you've got the ability. Ability's not that hard. What is surgery? It's based on anatomy. It's been around for 481 years. 400 years before I was born, all written down. If you know anatomy, you know the steps of the operation, that's not too hard. It's in books, and you've seen a lot of operations. Write down the steps when you watch, Ravi Mukha do an operation. Don't get them wrong. And, the Hallstadian principle of tension, counter tension, and, not putting it together on things under tension. And if you can control hemorrhage, if you can control hemorrhage, you can do any operation. So you've got the ability. You're good to go. But you got to say yes, because you never have a second chance to make a first impression. If you say no, that guy may never call you. And you don't criticize him, even though, tell me something. And then that gets to the 4th A, appreciation. Once you've taken care of the problem, you get appreciation back to the referring surgeon, even though, my God, that guy gets treated. Second, this, appreciation brings you communication to the referring doctor.